For decades now, a series of just devastating, high-profile inquiries into the NHS have shocked the nation. We're talking about everything from contaminated blood to catastrophic failures in maternity care. But today, we're going to do something a little different. We're not just looking at one of these tragedies, we're going to look at what they all have in common. Wow. Just let that sink in for a second. And you have to remember, behind every single one of these dry, official reports, there are thousands of stories just like that. Stories where the human cost it's almost unimaginable. And it all leads to one central, deeply troubling question. Why does this keep happening? So, here's the first thing you realize when you start looking at all these inquiries together. These aren't just a bunch of one-off, isolated incidents. No, it's a pattern, a repeating, decades-long pattern of tragedy. And this timeline, it just lays it all out, doesn't it? This isn't ancient history we're talking about. We go from the contaminated blood scandal way back in the 70s and 80s, all the way up to these horrific maternity failures that are happening right now. And the scary part? It's the same fundamental problems showing up again and again and again. So, when you put all these reports side by side, this really disturbing picture starts to form. And it's not a picture of a few bad apples, It's a picture of the whole system failing in the exact same ways over and over again. So let's break down exactly what those failures are. Okay, so the first major theme that just jumps out at you is this wall of silence. It's a deeply ingrained culture of defensiveness. A culture that doesn't just, miss warnings, it actively pushes back against them. Take the Gosport inquiry, for example. We now know that nurses were trying to blow the whistle on the dangerous use of opioids way back in 1991. And what happened? Their warnings just went unheeded. They were totally ignored by the people in charge. Okay, now fast forward decades, and investigators looking into maternity care in East Kent, they found the exact same toxic culture. It's incredible. You've got staff who are terrified to speak up, problems being swept under the rug, and anyone from the outside who dares to question things is met with just pure hostility. This is what's so wild. Look at how this pattern of denial plays out. In Morecambe Bay, a whole cluster of baby deaths is just written off as coincidental. Can you believe that? In East Kent, a really critical report from the Royal College gets dismissed as hearsay. And at Shrewsbury and Telford, sure, concerns were raised, but did anything really change? Nope. It's the same playbook every single time. Deflect, deny, and dismiss. So let's be really clear here. This isn't just a case of bad communication, right? This was an active, defensive wall. A wall built by the institutions themselves. And that wall is what stopped these huge problems from being fixed before even more people got hurt. And that wall of denial leads us right into the second theme. And honestly, this one might be the most heartbreaking of all. It's this systemic, top-to-bottom failure to listen to the very people the NHS is there to serve, the patients and their families. You see this so clearly in the maternity inquiries. Mothers in the middle of childbirth knew something was wrong. They raised concerns, they voiced their fears, and they were dismissed, told they were being hysterical or that they weren't trying hard enough. Their voices just weren't heard, and the consequences were absolutely devastating. And then you have the contaminated blood scandal. This quote, it just perfectly captures that huge power imbalance, doesn't it? Families put all their trust, all of it, in the doctors. And those doctors then failed to tell them about the life-altering, often fatal, risks of the treatments their kids were getting. And this right here, this is the ultimate deflection tactic. When things went horribly wrong, what was the institution's first move? Well, as the Ockenden report found, it was often to look for ways to blame the victim, to blame the mothers, instead of looking in the mirror at their own broken systems. And this pattern of dismissal, it's everywhere you look. Blaming women for how their labor went, refusing to give families straight answers, writing off legitimate concerns as just being emotional. Think about the Winterbourne View scandal. The Mental Health Act was actually used to control patients whose challenging behavior was, guess what, a direct result of the abuse they were suffering. So this isn't a one-off thing. It's a tactic, a recurring tactic that just piles more pain and injustice on top of an already unimaginable loss. Okay, so let's recap for a second. You have staff warnings being ignored, you have patients and families being dismissed. So the big question is, who's supposed to be holding the system to account? Well, that brings us to the final piece of this tragic puzzle. This whole complex web of regulators and official bodies that just consistently failed to step in and do their job. This right here, this is a perfect illustration of that paralysis. Just look at the Gosbor case. A complaint gets passed to the police. What do they say? Oh, that's a clinical decision, not for us. So it goes to the General Medical Council. They delay. Then it goes to the Department of Health. They wait for the GMC. You see what's happening? It's a game of hot potato. Each organization just passes the buck to the next one. And the result is years and years of delays and zero accountability. And check this out. It's such a stark example of regulatory failure from Morecambe Bay. You have the CQC, the Care Quality Commission, right? Their entire job is to ensure safety. But what did they do? Even though they knew there were huge problems in the maternity unit, they actually downgraded the trust's risk rating. Can you believe it? They let it become a foundation trust with no strings attached. Just a massive, massive failure to act. And sometimes it wasn't just inaction, it was worse. In some of the most chilling cases, there was active concealment. The contaminated blood inquiry found that some doctors, now get this, deliberately changed death certificates to hide the fact that someone had died from HIV/AIDS. Now, part of it was to protect families from stigma, sure, but it was also to dodge insurance problems and, you guessed it, avoid any official investigation. So, when you step back and look at the whole picture, the culture of denial, the way patients were just ignored, the complete failure of the regulators, it all brings you to one big question. What is the lesson here that just isn't being learned? And this is the absolute key takeaway. This was never, ever about a few bad apples. It was about an entire system. A system where denial, defensiveness, and a total lack of accountability are so deeply baked in that they let these awful things happen over and over and over. The system's most fundamental duty, the duty to listen, was just broken. And the sheer scale of the human tragedy, it's just staggering. I mean, look at that number, 1,862. That's how many families' cases were looked at in just one of these inquiries, the Ockenden Review. It's just a brutal reminder that behind every statistic and every report, there are thousands of real people whose lives were completely and utterly shattered. You know, the harm doesn't just stop with the medical failure itself. As the East Kent report so powerfully points out, it's what happens after. It's the denial, it's the blame shifting, it's the refusal to give answers. That's what causes this profound, lasting damage. It just shatters a family's trust, not just in the system, but in themselves for years and years. And so here we are, right back where we started. After decades of these inquiries, after all the reports, all the recommendations, all the solemn promises of never again, the evidence is clear. The same toxic patterns are still there, which leaves us all with one final, absolutely vital question. What on earth is it going to take for these lessons to finally be learned?